Okay. My hope, Joan, I was thinking maybe we can talk and someone can send me a list of those counties that don't have any access to free testing. And when I send out the notes and the slides, I can list those because Giovanni said she has some ideas on how to contact some people in those counties. And it would be 95 is so much better than it was like in the beginning, but 103 or 105 would be great. Okay, I'm going to quickly now pass the floor to Becky Prawl, RN, Immunization Section Chief of KDHE, and she's going to update us a little bit about how the rollout of the Bridge program is going. Thank you so much for being here.
Good afternoon, and thank you, Dr. Garcia. Next slide, please. So I believe by now, most of you on this call are familiar with the Bridge Access Program, but in case you are not, the Bridge Access Program is a program that is meant to bridge from the U.S. government supplied vaccine that we had during the pandemic, where it was free for all, into, fingers crossed, what we hope in the future to be a Vaccines for Adults program, which would provide all recommended vaccines for adults. We're not there yet, but at least we have this bridge right now. This is for COVID vaccine only. It is for ages 18 years and older. And I do have an asterisk there because previously when CDC was first discussing launching it, they had it listed as 19. And the reason for that is because the Vaccines for Children program runs for eligible children from birth through 18. And so this would make an 18-year-old eligible for either the Vaccines for Children program or the Bridge Access program. The only reason we would tend to lean towards the VFC program is you'll see in the next slide, there are a lot more COVID vaccines available through that program than there are through the adult program. But the eligibility for this program is adults who are not covered by any insurance or for whatever reason their insurance does not cover it. The truth of the matter is it really is just to remove cost as a barrier so that folks can get vaccinated and be protected. This program does have two different kind of sides to it, if you will. There is a side where our local health departments, our federally qualified health centers, and different doctors' offices can enroll in the program and provide those vaccines to either their patients or to folks in their community. There is also the pharmacy side where you will hear a little bit more right after I speak for just a little bit. And it's just kind of having two parts to help protect people and kind of get as much vaccine out as we can. Next slide, please. So just a little bit on the rollout of COVID-19 vaccine. Unfortunately, when new vaccines are released, sometimes there is a little bit of a delay. Folks want it and manufacturers are trying to ramp up production. So we have seen just a little bit of a delay. We have heard some private providers who are having a little bit of issues getting it, but hopefully the kinks will get worked out. Manufacturers will get plenty of vaccine out there and we will see it available for everyone who is interested. Just for your awareness, the Kansas Immunization Program through all of our programs will be receiving just shy of 157,000 doses. Of those, by the funding we received from CDC, 72% of them will be available for the Vaccines for Children program. 8% of those will be available for the Title 21 covered CHIP kids, and then 20% will be available for the Bridge Access program. So as of right now, we have received 30% of what we should get in the end. And we hope here in the near future that we will have more doses available so we can get it out and get that available for folks. Next slide, please. So Dr. Divi had talked about the vaccine finder at vaccines.gov, and I just wanted to provide this in case anyone has a question on how it works. So once you click on that vaccines.gov, it's going to ask for a zip code, and you can change that range to a smaller range or a larger range, depending on the radius. Maybe you're going somewhere else and you want to see if there's a vaccine available in that area. And then you would choose the age that you're interested in. So is it for a teenager or an adult, or is it for a child? And next slide, please. Once you make that choice, it's going to allow you to narrow down those decisions. So it's going to populate multiple locations of where the vaccines are available, and you could just choose by bridge access. As you'll see on the right part of this slide, each location, so it may have a health department or a pharmacy or a doctor's office, but each of those locations are going to indicate who they can vaccinate. So pharmacies can't vaccinate 6-month-olds. So it's going to indicate the ages, and it will also indicate which participants are bridge access program enrolled. And that is all I have. Thank you very much.
Thank you, Becky. We have a question from Giovanni. Giovanni?
I do have a quick question. Can everybody hear me?
Yes.
Yes, okay. Becky, my question is, during COVID-19, there were a lot of providers that charge patients an administrative fee. So for those patients that were uninsured, or even if they went through like a community COVID-19 event, providers were charging $50 for administrative fee. Is that going to be allowable under the Bridge Care Access Program?
So through the Bridge Access funding, providers should be receiving reimbursement for that. So they that won't be an issue for patients. There's some funding through the pharmacy side. There's some funding through HRSA for the federally qualified health systems, and there'll be some funding for others as well.
So just to say, if a patient happens to get a bill, can they call where they got it from and talk about it? Or I guess I don't know if that's because they shouldn't be getting bills. Is that right?
Correct. So
Okay.
a patient should never be turned away for the inability to pay.
Another very quick question, Becky. I know that in just talking with a couple of federal qualified health centers, many of them only vaccinate their established patients. And so I know that some of the health departments are kind of, short-staffed, and sometimes it's hard to vaccinate anybody that walks in. So they set appointments. For those counties that don't have a pharmacy available, what other options do they have?
I think right now we're trying to determine across the state what locations we have that are enrolled, and pair that with the pharmacies that are also available. I know there are still providers who are kind of onboarding onto that. And our hope is just to make sure that we can provide that vaccine at some location.
Yeah, I feel like that's something we're going to be looking at. Like, where are the gaps, and trying to figure out how to fill them. Maybe with pharmacies, which is a great segue to our next speaker. Amanda Applegate is going to update us on her work with the independent pharmacies and onboarding them with the E2 North so that they can participate in Bridge. Amanda?
Yes. Do you want me to share my screen here?
Yeah, that'd be great.
Okay, perfect. And there we go. Okay. So I am here. My name is Amanda Applegate. I am with the Kansas Pharmacists Association, and we've been working real hard to get pharmacies onboarded, get COVID vaccines into sites, and then thus into arms. So a few hiccups along the way, but I am here specifically to talk about the Bridge Access Program and how we can make sure there's a pharmacy in your community that has access to these vaccinations and can get them into arms. So Becky mentioned the Bridge Access Program here, vaccines available with no copay, no charge to the patients, at least from the pharmacy side of things, because HHS does have an administration fee that the pharmacy will be paid. So patients will not receive bills from the pharmacy for these COVID vaccines administered through the Bridge Access Program. There are 3 different federal HHS contracts with pharmacies. Those are with CVS and Walgreens, which, as you may know, are primarily going to be in larger towns. And then eTrue North covers every other pharmacy in the nation that is not CVS and Walgreens. So that's primarily what I'm talking about here today, just because that does address the needs you'll be seeing in many of your communities in the state of Kansas here. So CVS and Walgreens do have their own pathway, but again, I'm speaking specifically to the Bridge Access from eTrue North side of things. So the patient access side of things, it was mentioned already, vaccines.gov. I honestly recommend starting there for patients because there's going to have at least somewhat updated inventory. So we have been seeing quite a few inventory issues with pharmacies being unable to access COVID vaccines in many cases. So that vaccines.gov does have updated inventory as long as the pharmacy has been keeping it up to date. eTrue North then does direct patients to covidaccess.com to register. The website is available in English or Spanish, which is helpful. There is also a 1-800 number that is available for patients that do not have internet access to be able to register. I put that in quotation marks to some degree because they are discouraging use of that toll-free number, unfortunately. I actually called it today to see if I could register and was basically told if you have access to a computer, you need to go through this process. Once you do, get to that covidaccess.com, you'll select the pharmacy to get the vaccine at. This will not communicate with the pharmacy, but it does basically help them on their back end. All of the HHS contracts do require an insurance verification to be performed. So the patient will need to enter in whoever is getting the vaccine. So whether it's, you entering it on behalf of a father-in-law, kid, et cetera, it will check. So if insurance is there, so if, for example, they do have access to Medicaid or commercial insurance, they will be directed out to use that instead. And once, they confirm no insurance is provided or there has been a copay experienced, the patient will receive a voucher number, which they can either print out if they, for some reason, have access to a printer or write down to bring into the pharmacy. So then on the pharmacy side of things, there's a couple of different options. Ideally, the patient has that voucher, brings it in, and the pharmacy can process that exactly as insurance. So the patient walks away with no copay. If the patient has gone through that full process, but they don't have a printer and they forgot to write it down, there is a help desk available. So the pharmacy can take, some time, call the help desk and retrieve that voucher number for the patient. Or if the patient brings it in on a cell phone or something like that, they can just, show their cell phone to the pharmacy and the pharmacy can use that voucher number. But, obviously internet access is a challenge. Phone access is a challenge in many cases. So I think probably almost the most likely scenario is patients that are uninsured walking in that have not been through that registration process. And in that case, the pharmacy team can fill out that information for the patient to generate that voucher number. So many pharmacy teams that are participating in this program are aware of that and willing to help patients out in that regard. So there's definitely gaps in access right now. I think we're all pretty well aware of this, is that the CDC is working with HHS to review the reach of these programs, factoring in things like economic census data. There is no time frame that we're aware of to help get pharmacies in these underserved areas onboarded. So we have been working at the Pharmacy Association, working with KDHE and eTrue North to recruit additional pharmacies in areas of need to get them, onboarded as soon as they have access to vaccines. So we're going to be, again, working in close coordination with everybody to get people. If you have a pharmacy in your area that is not yet participating, they can go to joinetruenorth.com to register their interest. And I just went to vaccines.gov earlier today to look at bridge access programs. And I think I was looking at specifically at a 100-mile radius from Quinter. There's not much out there right now, I think, as we're well aware. So we have some work to do. We're well aware of that, and we'll certainly be working with it too. I think one of the challenges for this is that I put in here, there's contracting issues. It's not simply as easy as a pharmacy, us looking at a pharmacy and saying, go to eTrue North, sign the contract they send to you. Because there's some dicey contract terms in there, which I think is why it's taken a long time to get some of these pharmacies onboarded. eTrue North is not negotiating with individual pharmacies. So if they're unwilling to sign that contract, they're waiting in most cases for a larger entity that the pharmacy is working with to negotiate terms with eTrue North before signing. So there's quite a few pharmacies out there they're just in a holding pattern right now, waiting for lawyers to work it out between themselves. So like I said, it's not quite as easy as it should be, but unfortunately, I think that's how all of this rollout has been too. Just a few other issues I mentioned. We have had some issues accessing vaccines at many pharmacies, both hospital pharmacies, clinic pharmacies, and retail pharmacies. But hopefully, over the next couple of weeks, manufacturing and distribution should be ironed out overall. We're seeing in a lot of cases, the Part D plans are paying very poorly at the pharmacy. Some cases, pharmacies are losing money administering these vaccines. So I think it's something we're certainly watching because it could develop into more of an access issue. Blue Cross Blue Shield of Kansas City is also paying, or Blue Cross Blue Shield of Kansas is also paying some very under $10 for pharmacies to administer these. So I think that's been a big frustration with pharmacies getting these vaccines and getting them in arms. And that with both Bridge Access Program and Kansas Medicaid, pharmacies have to administer the vaccine. They buy the vaccine, administer the vaccine, and in some cases, they're waiting up to several months to be paid for that. So it's certainly been a challenge. We have a lot of pharmacies out there that really want to help. So we're doing what we can to get them in the right place to be able to help their communities. So if you have somebody you'd like me to work with or reach out to, very happy to do so. I've put my contact information here on the screen. Please don't hesitate to reach out to me or give your pharmacy contact information so we can help, get access in your communities.
Thank you so much, Amanda. I feel like this part of it is so important, and it sounds like it's not easy in so many ways. But thank you. And I have high hopes that slowly, the access will be better, especially in the rural areas. Okay, so we are winding down. I would like to open the floor to anybody who might have an announcement about an event or a question.
I can provide, Shelley asked the question about if there's documentation for being underinsured or uninsured. And I will say on the pharmacy side, that's why they have you go through that registration process. CVS, Walgreens, and eTrue North pharmacies will have you input your name, date of birth, and it will basically bump up against a national database of insured patients so that if you do have commercial insurance or public insurance, it will tell you use that instead. And the pharmacy can usually help look up whatever insurance that is.
Thank you.
On the clinic side, they don't have to provide any documentation as far as if they can just state that they're uninsured or underinsured.
Wonderful. Anybody have any announcements?
Dr. Garcia,
Yes.
this is Dr. Counts.
Hi.
Hi, everyone. I did put in the chat that the Unified Government, Wyandotte County Health Departments and their initiative have reestablished our neighborhood-based clinics. And I listed just off a few of some of the partners that are out there that are vaccinating, also doing lifespan immunizations. And we do this mainly throughout the week to help offset the rush to the health department, and also be in neighborhoods where our uninsured and underinsured live. And we operate on weekend hours and at special events. So there is a monthly calendar that comes out from UG listing all these different sites, the times, the dates, and what they have to offer. And KFB, Kansas Black Farmers and Family Counts, we are on that list. So I just put that out there. Now, I don't have the skills and technology to put the calendar out there, so I sent it to Courtney. I know she's a little more technologically savvy, so if she could put that out in the chat. That's one of the resources that we have available in Wyandotte County that also covers Piper as well as Bonner Springs. So just wanted to share that tidbit of information.
That's amazing. And I can send out the link to that within the follow-up email so everybody can have it. Okay, wonderful. Well, we're at time. I appreciate everybody for being here. See you next month. And we'll wrap up. Bye, everyone.